Danielle Matus, one of the prolotherapists at Caring Medical, talking today about Achilles tendon tears and degeneration and how they can heal with prolotherapy. So for those of you unfamiliar, prolotherapy is a regenerative injection technique that stimulates repair of injured tissue, where we actually do injections around an Achilles tear or degenerated tendon to essentially lay new healthy tissue and get athletes or the average runner or whatnot back to their activities. Most people that we see in the office that have an Achilles tendon tear or degeneration have quote unquote tried it all. They've tried resting the tendon, anti-inflammatory medications, ice, maybe even immobilizing it, and they may still have chronic pain. They can't still run or play basketball or do any of the activities that they love, so they end up actually in our office for evaluation. Achilles tendon degeneration and tears heal very well with prolotherapy, but we often may have to differentiate the type of treatment depending on the injury. Degenerated tendons heal very well with dextrose prolotherapy, where we actually inject dextrose into the tendon and work to regenerate that tissue and make new healthy cells, and over several months can regenerate that tendon to the point where patients can get back to running or cycling or basketball or what have you. When the Achilles tendon is torn, it may actually have to be treated a little bit differently depending on the patient. Like I said, we can inject dextrose into a degenerated tendon to regenerate tissue, but if we're trying to essentially glue back fibers that are torn, we may actually have to get cells from the patient, which is where something like platelet-rich plasma or PRP comes in, where we draw some blood, we concentrate the growth factors out of it, and we actually can inject it into the tendon right where the tear is with ultrasound guidance. Now, typically, in order to get a tear to heal, especially for the Achilles, we actually oftentimes do immobilize the area. We put patients in a boot for an extended period of time. When you're not actively regenerating a tendon, like with prolotherapy or PRP, immobilization isn't ideal because tendons do need motion. However, the little exception to that is if we are actively putting in PRP or actively putting in solutions that are trying to heal that tear and kind of get it to come back together, those are cases where immobilization actually may be necessary. I'd like to discuss a case with you actually that we've seen in the office on an Achilles tendon tear. A 41-year-old male, avid athlete came in, had this, Achilles tear, chronic issue, hasn't gotten better, with traditional treatments like rest and ice and so forth. And we actually did try a couple of dextrose treatments on it because it was his mid-season, trying to allow him to heal and get better. And when that wasn't really meeting our goals, we instead did PRP, where we, again, drew out some blood, got the growth factors, injected it into the tear, had him wear a boot actually for a couple of months with some treatments in between. And it's actually quite remarkable how much that tendon filled in. When we talk about, athletes, sometimes on their off season, that's actually when they can heal more, when they're not actively putting stress on the joint, which is what we did in this case, and really, as you can see with ultrasound images, this tear is filling in quite nicely and this patient is doing really well.